and how we should conform to stigmatization, and just because the sight of looking your mother peeing in her pants because she cannot control her due to terminally illness is just a sight for sore eye. Therefore, we should push her for physician-assisted suicide. So these are the characterizations coming from the side of the government who are inhumane, and these are the individuals who put a bad name to the healthcare system. So moving on to our first few things that they failed to tell you. Firstly, more importantly, they failed to tell us where is this motion is supposed to be set. Why is it so important? It's because we wanted to know on what are the health or the options that are available for palliative treatment, and we also need to know on how society is open to it and how the doctors in themselves will be able to carry out this or not. And also what's more also they never proved to us whether there is an urgency of this case, or there was cases of precedents of people who wanting this at the end. They just tell you because of this terminally ill patients are going through a lot of pain, are going through a lot of emotional trauma, therefore we should just simply allow them to have this law to be granted at the end of the day. But even if there was an urgency, opposition still believes that the sanctity of life should be protected because of a few reasons, which I will tell you in the second part of my speech, right? Then more importantly, right, they never proved to us any of their burden of proof, which is firstly, why should the quality of life supersede the sanctity of life at the end of the day, and or more importantly, on whether or not people who are actually be doing this will be accepted, because all they say that doctors can simply opt out of the system at the end of the day. So if you have a majority of doctors who don't agree with this policy that you're going to say, and the majority of doctors opting out with the solution, then what are you going to achieve at the end of the day when there's no doctors or no physician to allow you to have physician-assisted suicide at the end of the day? So and this patient will still be pushed for terminally ill to die naturally. Sit down, sir. I'm not going to take. And then now moving on to the second part of my speech. Firstly, on what are the nature of this terminally ill. The third speaker have been telling you how because of how these people, how they don't want to die and stuff, but because of a lot of pain pushes them to go for this policy. But we tell you essentially, like, when these people are being diagnosed with terminal, they will undergo 4 stages, which is acceptance, denial, compromise, and then they will lead to a stage of acceptance. This is why it's very important for government to push palliative care, so that this terminally ill patient will opt for palliative care, and they will progress to the stage of acceptance, where they will then move away from the stage of being traumatized, remove from the emotional burden, and so on, and they will then learn to self-actualize, where they can create will, and they can and also integrate with their family members, sit down, and also more important, but then they only tell you because of a lot of pain. So from their characterization, we can see that there is no rational calculus by these terminally ill patients. Essentially, there is no maturation for this patient because they're so desperate, because they're in a lot of pain. Therefore, that's why they go for this. But at the end of the day, there is no informed choice. If there is no informed choice, then how can this policy be a good policy and should be implemented when government essentially is to protect this individual? The role of government is to function as a third party so that no one will infringe on the right of another person and no one will harm the life of another person. So if this particular terminally ill patients are in a state of denial, are in a state of acceptance, in a state of a lot of pain and traumatized, essentially there is no rational calculus that has been going on in their mind, and the role of the government is to prevent them from acting in desperation to overcome their pain by simply killing themselves. So this is why it's important for government to play that particular role rather than just overcoming the limitations of doctors, or just simply allowing them, just because it is sight of a sore eye, to see your patient, your parents in diapers and so on. But more importantly, on the second part is about the idea of cost. The first speaker tells you how this ethical board is to decide on whether cost should be the weightage, and so we tell you that this is also as a form of discrimination essentially, right? So if you're going to have a terminally ill patient who is rich, right, and probably cost is not the idea why he wants to die, then essentially this terminally ill patient can die because cost is not the problem why he wants to die. So what about the poor people? So you're going to not allow them to have access to this just because the reason why they want to die is because they don't have money for resources. But more importantly, right, even if resources were the idea, we still believe that because of palliative care and because of the problem that they never have a place setting, right, we see in places such as Malaysia, right, how government is always pushing towards palliative therapy. We can see that there's a rehabilitation hospital being set up in Cheras, how government has always been providing the idea of sanctity of right. And we can see that there have been debates in parliaments how government is actually moving away from life sentences such as hanging and so on, how governments still believe that there are movements toward protecting the sanctity of life. What essentially they're trying to do is just trying to create a way so that for them to safeguard their mechanism and do not look bad at the end of the day, when they essentially have never exactly analyzed the weightage of the idea, right? And but more importantly, moving on to before I move on to my third question, yes.
Yes, madam. So when palliative care fails for a patient what role model for the patient?
Well, if palliative fail for that patient, more importantly, at least we can still prescribe them with analgesics so they won't go a lot of pain while they're dying at the end of the day, rather than them just simply jumping off from palliative care and putting this patient to death at the end of the day. So how essentially our policy is still a lot more better than theirs for the overall benefit. But thirdly, on what exactly is considered inhumane. They believe that for doctors to leave these patients on bed and to die naturally is considered inhumane. But we tell you that how this challenges the human benevolence. This challenges how innate human views about another person. If you see another person is about to die, is about to suicide by jumping off the building, you don't just let him jump off the building. How naturally human will have an instinct to probably call the fireman and to stop this person from jumping off the building. So we see that there's a human benevolence there. So what essentially that they are trying to do, they are challenging this human, and they are also removing this from the society as a whole. And more importantly, the idea of what is the role of the doctor. The role of the doctor has always been picturing to you of how they are going to provide you with hope. Even if they cannot cure you at the end of the day, they are supposed to assist you to go through the few daily challenges of life. And that's more importantly than rather than just because they cannot cure you, so they're going to allow you another choice, which is death. That is not the role of a doctor. That's not the role of the healthcare. The role of the healthcare is to improve lives and to allow these individuals to self-actualize, even if they are going to die in a few months' time, right? And also we told you of how if you in this policy, right, in a place setting such as a conservative, where majority of the doctors are conservative, right, and how you're going to push these doctors into mental depression, right, because they don't want to do it, right? So how and simply because if they don't want to do it, they have to quit their job. So essentially, if I was passionate about saving lives, then I have to quit my job in saving lives just because this particular government is going to make me allow the patient to assist suicide. So how is that fair at the end of the day? And we can so how is that fair at the end of the day? So a lot of stigmatization towards natural death has also been coming from their side. How it's bad, how wetting in your pants is bad. Where we can see that the stigmatization is really coming from their side, but it's never really justified at the end of the day. Why should these terminally patients die? So with all these reasons, side opposition does not support physician-assisted suicide. Thank you.